Good day, everyone. My name is Tolulope Abo. I am here before you to shed light on a critical topic of health awareness on mental health and stigmatization. Lots of us imagine a life filled with vitality, energy, and a deep sense of well-being. A life where you wake up each day feeling refreshed and ready to take on the world. This is the promise that health awareness owed for each and every one of us. What is mental health? Mental health refers to a person's emotional, psychological, and social well-being, which includes emotional stability, stress management, and the ability to foster positive relationships. It affects how we think, feel, and act. Some of the symptoms of mental illness includes excessive worries or fears, detachment for reality, hallucination or paranoid, suicidal thinking, excessive anger, violence, when you have confused thinking and reduced ability in relation to concentration. Several factors can cause mental illness, such as inherited traits. It is more evident among individuals whose blood relatives have had history in relation to mental illness. Environmental exposure before birth, exposure to alcohol or drugs, inflammatory conditions before birth, physical or mental abuse, even physical trauma such as head injury, brain chemicals. Some of all these are major things that can lead to mental illness. Sometimes a major life event, like a job loss, divorce, cross-country move, or new diagnosis. Other times a medical problem can lead to symptoms of mental illness. Thyroid disease can also lead to mental illness such as depression. Some common types of mental illness include anxiety disorder, mood disorder, eating disorder, psychotic beliefs. Some of the treatments of mental illness includes medication prescribed by a qualified medical doctor. Then we can also use psychotherapy that entails talking to the person involved. Stigma and discrimination can contribute to worsening symptoms and reduce likelihood of getting treatment. Stigma is when someone sees you in a negative way because of your mental illness, and discrimination occurs when someone treats you in a negative way because of your mental illness. We all have a role to play in creating a mentally healthy community by getting to know people with personal experience of mental illness, so that you can learn to see them from the person they are rather than from their illness. As a certified nursing assistant, I have worked in a psychiatric hospital, also known as mental health hospital, where we specialize in the treatment of severe mental disorders. I have seen lots of cases of mental disorders. I have also conducted extensive research with up-to-date information about this topic from sources which are, the title of one of the sources is Awareness, the Stigmatization of Mental Health, Vital to Build a Healthy Society. The date published was 2022, October 27, and it was published by Province in Pakistan. Then the second source I got the information from was from Student Organization of Mental Health host Destigmatization Events, which was published in 2019, December 1st, by the University Wired. This was retrieved from Howard County Education. You can log in to find out more about it. I feel it is necessary to share my knowledge in order to educate others. In conclusion, people who are challenged mentally should be treated well. They should be supported fully, morally, in order to encourage them to go for their treatment. Health and wellness are lifelong journeys. By making conscious choices and patronizing our well-being, we can empower ourselves to live in a vibrant life. Thank you for your attention.